hiccup. We had a little surge in the office, but it's no big deal. Thank you so much for jumping back on. And there were a couple other questions I want to make sure I got to that I saw in the previous feed. So if you don't mind, be sure to share this. This live video to make sure that those who jumped on the last one can actually see this one as we start to kind of wrap things up and get a few more questions in to both Representative Humphrey and Dr. Pradeep. But Dr. Pradeep, there was a question earlier about if someone, and you know what, we can kind of get into a lot of weeds, and let's be honest about that. I mean, everybody's got different symptoms and different physical challenges. So I would imagine that there is a main source, maybe cdc.gov to go to. But there was a specific question from one of our viewers earlier about what if they had asthma? How would it affect them?
So people who have asthma, COPD, any kind of lung disease, they're at a much higher risk of dying with this. Because even after the coronavirus infection, 20 to 30% of your lungs still get affected, even when you recover from it. Okay, so people who don't have that kind of reserve are at a much higher risk of getting on a ventilator, getting really sick and dying from it. That's the same risk with congestive heart failure. If you have diabetes, if you have high blood pressure, if you have coronary artery disease, your risk of dying with it is very high. Okay, so that's why we tell people that just because you are young doesn't mean you cannot die. Okay, so all it means is if you a 60-year-old, a healthy 60-year-old is not the same as an unhealthy 40-year-old. You know, anybody with an underlying medical problem is at a much higher risk of dying with it or getting into the hospital with it. Right. So those kind of people have to be extremely careful.
And the bottom line is that, if I heard you correctly earlier, is that, look, if you feel like you got any symptoms, the very first thing you should do is call your physician and ask them questions and let them run through their screening test for you.
Absolutely.
Because even 911 has changed their protocols to protect their staff as well. I was told there was a question, but I can't see it on here. Representative Humphrey, I know you've worked closely with our public school system, and I know you've got relationships with the private school system here, Parrott and Bethel. What kind of innovation are you seeing in terms of our education right now?
Well, we have I think every school system in the country now is dealing with the world's biggest laboratory. I mean, this is all really uncharted waters, but then again, it's not. It's just at a bigger scale. And having a daughter who's a high school student and another daughter who actually works in the school system, I can tell you that they're learning new technology every day. I mean, not my daughter yesterday said we're going to use Zoom tomorrow so we can actually see our teacher and actually interact. So I said, well, we use that in business all the time, but. So you're going to see a transformation, I'm sure. I mean, our education system, it's gotten a lot better, and this is going to help us, I think, on the world stage. But there's still work to be done, and but I think it's good that students can still stay engaged while they're at home, even though it's a little bit different feel. But it can only help us going forward.
I agree. In fact, I've seen firsthand some of the technology and some of the work by administrators. We actually had Mr. Brent Williams and some of his leadership here this past week for a very similar conversation, and the amount of changes they've made in such a rapid turnaround, it's been quite amazing how they've done it. And I mean, my kids went to bed one night, the next morning they had Zoom on their iPads. I mean, it's just they were able to push it out and give parents instructions. And my wife, who is a teacher as well as your daughter, I mean, they're working on basically virtual office hours right now. And just to think through that from an administrative perspective, how they would corral all of their staff to pull that off for 7,000 or 8,000 kids is pretty remarkable. And that's just here. There is a question for you, Representative Humphrey, and that is dealing with the issue with the executive order about the number of people. So there was a question about, can local churches still meet during this time in our city?
Yeah, I mean, if they're under 100, they can, but the recommendation is not to meet because of just like we've talked about, the social distancing factor. And I think most churches are trying to comply with that just out of understanding and hope and, just the consideration of others.
Right.
To keep
I've
this
seen a
from
lot
spreading.
of churches, just like with the school system, a lot of churches using live feeds and using video to do more of their ministry work. It's been quite amazing and awesome to watch that. There is, Dr. Pradeep, it kind of get down to the basics. As a physician, what are you telling your patients in ways that they can help reduce the spread from one person to the next?
So the first thing I tell my patients is, you shouldn't be here unless you're absolutely required to be here for some reason, okay? Mm-hmm. Then before they go, I sit down and tell them that I don't want you to go out into public. I don't want you to go out and have food, restaurants, no birthday parties, all of that. And I finally end with saying, yes, the recommendation is less than 100 people in the church. My answer to that is an emphatic no. Mm-hmm. I think God will understand. Mm-hmm. Stay home. Mm-hmm. Okay. There is no clear number that says, okay, less than 100 is okay. Less than 50 is okay. No, there is no number that says it's okay.
Right.
Who knows? Maybe it's less than 5. Mm-hmm. Go online churches. That's what I would recommend. Mm-hmm. What can you do? Wash your hands. But that's something you should have been doing even before. I
agree. I call that a standard of living.
Exactly. Now, try not to get into contact with people as much as possible. Mm-hmm. Going back to the social distancing, we are only trying to flatten the curve. Okay. At the end of the day, people should understand that this will affect the rich, the poor, the black, the white, mm-hmm. everybody. It does not matter. It is not going to discriminate between whether you're religious, you're not religious. All you can try to do is to control the spread.
Right. I've always found it fascinating that as leaders, people really want to get into the weeds, but as leaders, really getting everybody to just understand the basics and practice the basics really can do mm-hmm. a lot. And if you missed the conversation we had about the curve in Dr. Pradeep's little bit of statistical analysis on what could happen if we don't slow this curve, make sure you jump and see the first episode that we did of this. We had a little hiccup in the middle of it, and so a little power surge, so we had to start the broadcast over. But you can actually go back and watch the first part and see some of that. Moving forward, gentlemen, as you move. In fact, by the way, don't forget. We won't be able to get all the questions, but feel free to drop them, and we'll try to pass them on as well. But feel free to share this broadcast with others, because there's a lot of people who may want to hear this information as well. But as we move forward, Doctor, I know that your hope in putting some of that information out is to really just kind of tell people, hey, this is serious. Mm-hmm. But when I look out our studio windows right now, it's 80 degrees outside and sunny, and so we have this desire to have some normalcy in our life, but we also need to take it serious. What is your advice moving forward?
So my advice is, this is not the common cold. This is not the flu. This is way more serious than either of them. You just have to understand that it's only a matter of time. We will survive this. We just have to hunker down for the time being. Mm-hmm. There is going to be a vaccine. It's going to take 12 months to 18 months. There is going to be a treatment for it. You just have to give the healthcare workers enough time to get there. Don't overwhelm the system. And how do you do that? Social distancing. Mm-hmm. So right now, the only thing you could possibly do is social distancing, is what I would say.
All right. So that sums up Dr. Pradeep's words. Thank you, sir. And Representative Humphrey, I know there's a lot of conversation on the federal level. You've seen the president give a number of briefings, and the Treasury Secretary come out with some ideas. Are there anything other kind of economic benefits or anything you see coming from the state government as it relates to individual households? Not as I know we've had a conversation about small businesses earlier, but for individuals as well.
Well, the Speaker's office, just as soon as I walked in the door, had announced some task force committees that are going to be working together on a bipartisan level, and I was named to an economic task force, which will look at small businesses and what we can do to help alleviate some of their pain, whether it be sales tax. You're always going to pay and collect sales tax, but right. some things along those lines where maybe they can delay the payment of some certain sales taxes and get just other economic benefits for businesses. And so we'll be looking at a lot of different things. I mean, there's a healthcare committee, there's education committee, all kinds of task force committees that will be looking at ways the state can can help, because we are in fairly good financial position to offer some relief. What that's going to look like is anybody's guess, but what we are in a good situation that we can help citizens of North Carolina in one way or another.
All right. And in terms of our response moving forward, you feel the state's pretty well prepared to handle the population going forward?
I think so. I mean, the healthcare industry is going to be where the biggest pressure is going to be. I mean, there's just not enough doctors, and especially rural North Carolina now, to handle what we've got in healthcare workers. And Dr. Pradeep and I have had this discussion. He knows it better than I do because he's shared a lot of statistics with me. So, yeah, I think for the most part we're prepared. We will be in good shape, but we just got to use common sense, like Dr. Pradeep said. Just practice social distancing and stay away from large gatherings, and flatten the curve. And I think things will start to get better.
And watch Neuse. Dr. Pradeep, thank you so much for coming on, sir. Appreciate your service to our community. And Representative Humphrey, thank you also for coming on. Thank you for your service to our community as well. And thank you all for watching. And thank you so much for your questions, your comments. Again, those that we couldn't get to, we'll make sure we pass on to our guests, as well as I'm sure they'll go back and read them as well. If there's anything else we can do for you, please don't hesitate to let us know. Feel free to subscribe to our Neuse newsletter. It's free every morning at 7 a.m. And everything we do there is free, and it's just kind of our way of giving back and a way to make sure that you get very factual and accurate information. And definitely support the advertisers that we have there. And click on a few links, and just a way of saying thank you. And I want to say a special thank you to our tech team, Dr. Travis Town, and the executive producer, Brandon Potter. We'll make up a title. He is the assistant to the executive producer. And Aliza Throw, our VP of Operations, helping on the social media side as well. So thank you all for watching. Please be sure to share this. And thank you so much to our guests. And thank you again.